When you walk into a classroom, the first thing you notice might be the art on the walls or the way the room is arranged. But have you ever stopped to notice how the rules are written? Take a moment to compare these two posters. On the left, we see a list of rules that begin with don't run, don't hit, don't throw toys, don't yell. You get the picture. It's all about what not to do. Now look at the poster on the right. Instead of listing forbidden behaviors, this chart focuses on positive actions. Good hands, listening ears, quiet voices, walking feet, nice words. It even includes visual cues to help children connect each rule with something they can understand and remember. So, which one do you think is more appropriate in an early childhood setting? The answer is the right side poster. And here's why. Children respond better to positive, action oriented language. When we tell them what to do, we're setting them up for success. We're showing them the behavior we expect, instead of constantly pointing out what they're doing wrong. Let's imagine a child starts running in the classroom. If the only rule they've seen is don't run, it doesn't give them a replacement behavior. But if the rule is use walking feet, now they know what's expected. Also, think about how each poster makes a child feel. The one on the left might feel like a list of no's, a place where they're constantly being corrected. The one on the right feels more encouraging. It gives children a sense of control and choice. It builds internal guidance, not just obedience. And for children with learning differences or language delays, those visual symbols next to each rule make the expectations clearer and more inclusive. So as you design your own classroom environment, whether you create your own rules or adapt ones from your center, remember this: keep it positive, be specific about what to do. Use pictures whenever possible and model those behaviors yourself. Rules aren't just about keeping order, they're tools to help children learn responsibility, kindness, and self control. And how we write them can make all the difference. Now, let's shift our attention to something that might not always seem obvious at first glance: safety hazards. When you think of hazards, your mind might go straight to things like scissors or cleaning supplies. And yes, those are important. But in a child care environment, hazards can hide in plain sight, and often it's the everyday items or routines that create the biggest risks. Think about a toddler tripping on a toy that wasn't put away, or a preschooler climbing a chair to reach a high shelf, or a busy hallway with a spill that hasn't been cleaned up yet. These are the kinds of moments that lead to bumps, bruises, and even serious injuries, and many of them are preventable. So how do we tackle safety hazards before they become problems? It starts with awareness. Every day, do a quick scan of your space. Is everything in working order? Are walkways clear? Are materials age appropriate and safely stored? If it rolls, breaks, leaks, or topples, you want to know about it before a child does. Next, think about the layout of your room. Are shelves stable and anchored? Are electrical cords tucked away? Can you see all parts of the room from wherever you stand? And can children move safely from one activity to another without bumping into furniture or each other? Also consider the outdoor environment. Are climbing structures secure? Is the fence intact? Is the mulch or grass deep enough to cushion a fall? Is any equipment too hot from the sun or slick with rain? The goal is to identify and remove potential hazards, not once, but continuously. Safety isn't a checklist, it's a mindset, a daily habit, something that becomes second nature as you move through your day. And here's a tip: involve children in the process. Use simple language like, let's pick this up so no one trips, or we keep the blocks on the rug to stay safe. Over time, kids learn that being safe is something we all do together. So while supervision is your first line of defense, managing physical hazards is your second. The two go hand in hand. One keeps your eyes open, The other keeps your environment safe. When you combine both, you give children the freedom to explore, learn, and grow in a space that's secure and thoughtfully prepared. And that's exactly what they deserve. When it comes to preventing injuries, there's no magic formula, but there is a solid plan. If you want to reduce the risk of safety hazards in your classroom or outdoor space, you need to focus on 4 key steps. Let's walk through them one by one. Step 1. Recognize common hazards. This is your foundation. You can't fix what you don't see, so it's critical that you learn to spot the things that pose a risk. In an early childhood environment, common hazards can include wet floors or loose rugs, choking hazards left within reach of infants, sharp corners, unstable shelves, or broken toys, cleaning supplies that aren't properly stored, playground equipment that's too hot, too high, or too worn out. Some hazards are obvious, but others are easy to overlook, especially when your day gets busy. That's why regular visual checks of your space matter so much. Step 2. Know when and where hazards are likely to occur. Hazards aren't just about what, they're also about when and where. For example, transitions like arrival, departure, and cleanup time tend to be more chaotic, and that means more opportunities for accidents. Bathrooms, kitchens, and outdoor areas often come with higher risks. Anytime adult attention is divided, like when prepping bottles, taking attendance, or comforting a child, supervision can slip and a hazard becomes more dangerous. By staying mindful of high risk moments and spaces, you can plan ahead and adjust your supervision or room setup accordingly. Step 3. Know the child's abilities. What's a hazard for one child might not be a hazard for another. A toddler who just started walking needs completely different support than a 4-year-old who climbs everything in sight. Some children have physical delays, sensory sensitivities, or impulsive behaviors that increase their risk. That's why you need to understand where each child is developmentally, so you can anticipate how they'll interact with their environment. This doesn't mean you hover. It means you plan with intention based on what your group needs. Step 4. Remove or limit safety hazards. Once you've identified a hazard, take action. That might mean removing it entirely, like putting away broken toys, or limiting access by creating boundaries or adding protective covers. Sometimes we can't remove a hazard, but we can manage it. For instance, we can't remove a playground slide, but we can make sure only one child uses it at a time and that an adult is close by. And always document and report issues you can't fix yourself, like loose floor tiles, exposed wiring, or broken gates. To sum it up, spot the hazards, know the danger zones, understand the kids, take action. When you follow these 4 steps consistently, you're not just reacting, you're creating a safer space on purpose every single day. You don't have to be a safety expert to protect children, but you do need to know what to watch out for. When it comes to injuries and fatalities in early childhood settings, these 6 hazards top the list again and again. And the truth is, they often happen during everyday moments, in classrooms, on playgrounds, or even during transition times. Let's talk through each one. First, falls. Falls are by far the most common injury in childcare. Children fall off slides, chairs, changing tables, steps, playground structures, even while just running across the room. Many of these injuries happen when equipment isn't age appropriate or supervision is lacking. Think, are there stable handrails, soft surfaces, clear walkways, furniture that's anchored? Second, drowning. It might surprise you, but drowning is a real risk even in programs that don't have pools. Kiddie pools, toilets, buckets, and water tables can all become dangerous in just seconds. Young children can drown in as little as 1 inch of water, silently and quickly. Never leave standing water unattended, and never let water play happen without direct supervision. Third, burns. Burns can come from hot liquids, stoves, radiators, sun exposure, or even craft materials like glue guns. Make sure all hot items are out of reach, cords are secured, and sun safety is part of your daily routine, especially during outdoor play in warmer months. Fourth, choking, suffocation, and strangulation. This category includes so many preventable tragedies. Choking risks come from grapes, popcorn, coins, and small toy pieces. Suffocation can happen with soft bedding, especially for infants. Strangulation risks include loose cords, strings on hoodies, or even playground ropes. Always inspect your environment with a safety lens. Could a child wrap this around their neck? Could they get stuck here? Fifth, poisoning. Poisoning usually happens when medications, cleaning products, or art supplies are stored improperly. Always use child-proof locks, clearly labeled containers, and follow the out-of-reach and out-of-sight rule. And be mindful of plants. Some are toxic if touched or eaten. And finally, vehicle-related injuries. Whether it's a field trip, parking lot pickup, or walking near a busy street, young children are unpredictable around vehicles. Make sure loading and unloading areas are secure. Do name-to-face counts before and after every transition. And never assume a child is where you left them. Always check, then double-check. These 6 hazard areas aren't meant to scare you. They're meant to sharpen your awareness. Because when you know what the most common dangers are, you can take simple, proactive steps to prevent them. So, whether you're setting up your classroom, leading outdoor play, or supervising snack time, remember, safety starts with what you notice, and what you notice can save a life. Okay, now it's your turn to do the thinking. You've just reviewed the most common hazards that lead to injury or even death in early care settings: falls, burns, choking, vehicle-related injuries, and more. But knowledge only goes so far. The real power comes in knowing how to apply what you've learned to your classroom, your playground, your daily routine. So let's break it down. First question: when and where are these hazards most likely to happen? Think about your day from open to close. Where are children more active? When are you most distracted? Which spots in the room tend to get crowded, messy, or overheated? Hazards can pop up during transitions, during drop-off or pickup, or when staff are short-staffed or multitasking. And certain locations, like bathrooms, playgrounds, or entryways, are higher risk by default. Try to picture it. Where are the hot zones in your environment? Next, what is the child doing at the time? This is where development plays a big role. What's totally safe for a 4-year-old could be dangerous for a toddler. Maybe a child is climbing, exploring, or trying something new. Rushing to get outside, testing boundaries, mimicking an older child, or simply trying to help but without the motor skills or understanding yet. These behaviors aren't bad. They're age appropriate, but they can lead to injury if we don't plan for them. So ask yourself, what are your children learning to do right now that could change their risk level? And finally, how can you remove or limit these hazards? This is the part where you take back control. Start simple. Tape down cords. Swap out wobbly furniture. Block off high-risk areas during busy times. Offer extra support during tricky transitions. Pair new walkers with an adult hand. Sometimes it's about removing the hazard completely. Other times it's about reworking your space or your strategy to reduce the chance of harm. So take a moment now. Think through these 3 questions. When and where do risks show up in your day? What are your children doing that might increase those risks? And how can you adjust the environment or your response? Because when you start to see patterns, you can start to prevent problems before they happen. Let's take a few minutes to brainstorm together. This is the part where we start connecting the dots, turning theory into practice. You've seen the list of common hazards: falls, drowning, burns, choking, suffocation, and strangulation poisoning vehicle related injuries. But knowing what can go wrong isn't enough. We need to be able to spot the patterns, to ask, when and where do these injuries usually happen? Let's walk through them together. Falls usually occur during transitions, on stairs, or climbing structures. From changing tables, high chairs, or unstable furniture, during gross motor play when there's running, jumping, or pushing, and they're especially common during arrival and pickup, when supervision tends to be scattered and kids are excited or tired. Drowning isn't limited to pools. It can happen in water tables during sensory play, in a bathroom with a full toilet or tub, in outdoor containers left uncovered after rain. It often occurs when water play is unsupervised or when adults assume just a minute is safe. It's not. Burns can happen in kitchen areas, even if the child isn't supposed to be near the stove, from hot drinks or microwaved bottles, from touching heaters, radiators, or hot playground surfaces in summer. Burns are especially risky when adults are multitasking or assume they won't touch that. Choking, suffocation, and strangulation risks show up during meal times when children are eating too quickly or not seated properly, in nap areas with soft bedding or loose cords, with toys that are too small or break apart. This often happens when materials are developmentally inappropriate or supervision gets relaxed. For example, during cleanup or group transitions. Poisoning tends to happen when cleaning products are under sinks or stored in unlocked cabinets, when medications are kept in purses, cubbies, or coat pockets, when children explore areas that were assumed off limits. These injuries happen when storage is not secure or staff forget to double check the space. Vehicle related injuries are more likely in parking lots during drop off and pickup, on field trips when children are getting on or off a bus, when an adult assumes someone else is counting. Mistakes happen during transitions, especially when communication between adults is unclear or rushed. The goal here is not to feel overwhelmed, it's to sharpen your awareness. So keep asking, when are things most chaotic in my day? Where are blind spots in my environment? And what can I do differently to stay ahead of the risk? By asking these questions regularly, you don't just react to danger, you prevent it. And that's the heart of keeping kids safe. Let's take a moment to think about the children in your care, not just as a group, but as individuals with unique abilities, needs, and developmental stages. The safety risks children face can change dramatically depending on where they are in their growth. A strategy that keeps one child safe could be completely ineffective or even dangerous for another. So let's walk through each age group and highlight what we should be paying attention to. Infants are completely dependent on adults. They can't roll over, crawl, or sit independently at first, but that can change quickly. Safety concerns for infants include suffocation hazards from soft bedding, choking on small objects, being dropped during transfers, being left unattended on changing tables or soft surfaces. Infants need eyes-on supervision at all times, and their environments must be clear, soft, and secure. Toddlers. Now we've entered the try everything stage. Toddlers are mobile, curious, and impulsive. They don't understand danger and they love to explore with their hands and mouths. Hazards here often involve falls from climbing, choking on non-food items, bumping into corners and edges, pulling objects off shelves, putting fingers in outlets or mouths on shared toys. They're learning fast, but they need constant redirection and environments that anticipate what they'll explore next. Preschoolers. Preschoolers are developing reasoning skills and learning how to follow rules. but they still lack judgment and impulse control. They're more social, which means risk can increase in group settings. This is the stage where we start seeing running in classrooms, roughhousing, or unintentional harm to others, misuse of classroom materials, unsafe use of scissors or glue, curiosity about things like fire alarms, adult tools, or kitchen items. They benefit from clear safety rules, consistent routines, and modeled behaviors from adults. School agers. Older children may seem more responsible, but they often test boundaries, especially when they think they've outgrown certain rules. Common risks at this stage include horseplay or dares risk taking to impress peers, boredom that leads to distraction, use of electronic equipment, sharp tools, or even skateboards, like the one pictured here with school-agers. It's about engagement, boundaries, and mutual respect. Involve them in creating safety expectations and let them help lead by example. The key message here is simple: one size doesn't fit all. When you supervise and plan for safety, you have to take into account each child's age, development, and temperament, not just the rules posted on the wall. You're not just watching children, you're supporting individuals at different stages of risk, growth, and independence. Knowing that can make all the difference. We've talked about recognizing hazards. Now let's talk about responding to them. As an early care and education professional, your job is not just to notice danger, it's to do something about it. That means removing hazards entirely when you can, or limiting their impact when you can't. Let's break that down using the 6 major categories we've been focusing on. Falls, you can't remove gravity, but you can design a safer environment. To reduce fall risk, anchor shelves and furniture, install gates at stairways and ramps, use soft flooring or mats in high play zones. Supervise climbing areas closely, especially outside. Teach children to walk, not run, indoors, and reinforce that daily. It's also about layout. Keep walkways clear, avoid tripping hazards, and place high interest items where children don't have to climb to reach them. Drowning. Whenever water is present, supervision must be direct, close, and uninterrupted. To eliminate risk, drain water tables, tubs, and play bins immediately after use. Store buckets upside down. Lock bathrooms if children are not toilet trained. Keep toilet lids closed with safety locks. Post visual reminders about water safety. If your program ever uses pools or sprinklers, follow your licensing agency's strictest ratio and supervision guidelines. Never assume they're just splashing. Drowning is fast and silent. Burns. This one starts with access control. Children should not be near microwaves or hot plates, coffee cups or reheated food radiators, heating vents, or direct sunlight on metal playground surfaces. Craft supplies like glue guns or hot wax without direct supervision. Use thermal covers when possible. Avoid heating bottles in microwaves. And always check temperature before serving food, especially for infants. Choking, suffocation, and strangulation. This is where attention to detail is critical. To protect children, cut food into safe sizes. No grapes, popcorn, or hot dogs for toddlers. Remove drawstrings, cords, or necklaces from clothing. Check toys for small parts or peeling pieces. Keep crib areas free from blankets, stuffed animals, and pillows for infants. Store plastic bags out of reach and never use them for play. Teach children to sit while eating and discourage talking or laughing with food in their mouths. It may feel repetitive, but it saves lives. Poisoning often happens through carelessness, not malice. Stay alert by locking up cleaning products and medications, not just high up, but locked. Using child-resistant containers with labels. Storing personal belongings, like purses or diaper bags, out of children's reach. avoiding food look-alike products like colorful soaps or gel beads, reviewing what plants are toxic, and removing them from classrooms or playgrounds. And don't forget art supplies. Not all paints, glues, or markers are non-toxic. Always check labels and purchase from approved vendors. Vehicle-related injuries. This one is all about protocol and presence. Reduce risk by using name-to-face counts during every transition, positioning adults at multiple spots during arrival and dismissal, keeping gates closed and locked, teaching children to hold hands or ropes when walking, never allowing children to walk between parked vehicles, always checking the vehicle twice before and after a field trip, and remember, you are responsible until a child is safely handed off. Don't wave goodbye and assume someone else is watching. Whether it's a mop bucket, a cord, a cleaning spray, or a climbing shelf, ask yourself, can I remove this? If not, how can I minimize the risk and maximize protection? Hazard reduction isn't about fear, it's about preparedness. It's about creating environments where children are free to play, explore, and learn without facing unnecessary danger. You won't catch every risk, but with a safety first mindset, you'll catch most of them. And that can make all the difference. This next topic is perhaps the most important and the most sensitive part of your training. As early care and education professionals, nothing matters more than ensuring every infant in our care goes home healthy and safe. That's why this section focuses on preventing infant deaths, specifically from SIDS, sudden infant death syndrome, suffocation, strangulation. These are real risks, and every year children die in childcare settings, not because caregivers were careless, but because they didn't know how to prevent these silent dangers. So let's start with what we know and what we must do. Preventing SIDS is the sudden and unexplained death of a seemingly healthy baby, usually during sleep. We don't know everything about it, but we do know how to lower the risk. Here's the number one rule. Place every infant under 12 months of age on their back to sleep. Every nap, every time, even if the baby prefers their stomach, even if the family does things differently at home. In childcare, back is best. It's non-negotiable. Now, if the baby is able to roll over independently, back to front and front to back, it's safe to let them sleep in their preferred position, but always start them on their back. This practice alone has saved countless lives, and it's your responsibility to follow it every time. Preventing suffocation. Suffocation happens when something blocks a child's ability to breathe. Infants are especially at risk because they can't reposition themselves. To reduce suffocation risks, always place babies to sleep on a firm, flat surface, never on a couch, pillow, or soft mattress. Use a safety-approved crib with a tight-fitting mattress and a fitted sheet. Remove all soft items from the crib. No pillows, blankets, comforters, stuffed animals, or crib bumpers. Keep the baby's head uncovered. No hoods, hats, or swaddles over the face. This might look bare compared to how babies sleep at home, but in a licensed setting, that bare is best crib setup is what's required by law. Softness may feel cozy, but it can trap a baby's face and stop them from breathing. Remember, a safe sleep space isn't meant to look cute. It's meant to save lives. Preventing strangulation. Strangulation occurs when something wraps around a baby's neck or body, cutting off circulation or airflow, and it happens more quickly than you might think. To prevent this, remove all hanging toys or mobiles once a baby can push up on hands and knees. If they can reach it, it's a risk. Keep cords away from the crib. That includes monitor cords, window blinds, or electrical cords. Remove any pacifier clips or clothing with long strings, drawstrings, or necklaces. Anything longer than 3 inches is dangerous. And finally, make sure the crib is safe. Slats should be no more than 2, 3, 8 inches apart. That's about the width of a soda can. Anything wider could allow a baby's head to get trapped. All of these details matter because once an infant is in that crib, you're their only protection. For additional guidance, you'll find more information on page 13 and Appendix B, page 41 in your handout. These pages outline safe sleep regulations, crib specifications, and visual examples you can refer back to during your work. If you ever have questions, ask your director. Kentucky's licensing regulations are very clear on infant sleep safety, and failing to follow them isn't just risky, it's a violation. Let's be clear, no one ever wants to be the person who says, "I didn't know." Now you do, and that makes you powerful. The way you set up your nap space, the way you position a baby, check for hazards, follow the rules. It's not extra, it's essential. Because in your role, every small decision could make a life-saving difference. So take this responsibility seriously and never be afraid to speak up if something seems unsafe.